possible game changer for weight loss drugs. Eli Lilly says it's developing a GLP-1 in the form of a daily pill. Dr. Marc Siegel is here with this. And, a lot of people have been wondering when this was coming, that there's been a shot for a while, a daily pill. The benefits, the risks, how do you weigh it?
Well, first of all, I think it's going to happen, Dana, by 2026. It looks very promising. These are late-stage trials. Novartis has a drug. Lilly now has orforglipron that looked very good, where people lost 25 pounds, approximately over 10% of their body weight. We've been waiting for a pill because 12% of Americans have tried these drugs. About 6% stay on them. They work. They work at losing weight. They work at glucose control. They affect a lot of different organs positively. We don't have long-term data yet, but the thing that's the rate-limiting step here is not everybody tolerates a shot once a week. So this is definitely a game changer, and this is coming soon. And the results from these studies, this particular study, very promising. It looks safe.
As you mentioned, the average is 23 pounds of loss, 10% of body weight. But there are some complications. There have been some hospital visits, 25,000 hospital visits in 2 years, and 69% of those involve severe gastrointestinal issues. And then you also have things like permanent stomach paralysis, sudden vision loss, and life-threatening intestinal blockages. Are those extremely rare or things that people should be worried about?
Really good question. And the answer is GI side effects are common. It delays gastric emptying. So you can have your reflux get worse. You can have problem with constipation. You can have bowel problems. What's rare, really rare, are the complications you mentioned. But on the spectrum of things, GI side effects. And as far as vision is concerned, thyroid's another thing we're looking at. But vision, there are risks with the vision, and some of that is still being studied. So we have to say with a caveat, this is why a physician who really knows what they're doing, like an endocrinologist who studies this, needs to be in the loop. These drugs are really great, but they have risks as well.
Is it going to become like a multivitamin that everybody's just going to take one of these a day?
No, I think what's got to happen is everybody's got to exercise every day and change their diet, and this will be kind of a cherry on top for people who need it the most to stay out of my office with high blood pressure, diabetes, or obesity. Okay. So it's a cherry on top. It's icing on the cake.
And
wrong metaphor.
In other health news, there's been a lot of talk about these nicotine patches and vaping and all of that. You talked to the FDA Commissioner, Marty Makary. Let's play a little bit of that.
The COVID vaccine is still available for anyone. That includes 6 months of age and older. We are keeping with our promise that anyone who wants a vaccine can get it. Some of these groups don't have a very good track record. We're going back to peacetime protocols whereby the FDA receives data and analyzes it and decides whether or not a company can make a claim about their vaccine based on the evidence that they submit.
Dr. Siegel, forgive me. We have two different additional topics. One was on nicotine patches, but this was about the COVID vaccines. What about your interview with him?
I was impressed with him in a couple of ways. He talks about getting the physician back in the loop here. And that's because a physician can say you need one of these vaccines and you're going to get it. That's his point. The other point is that they're focusing on high-risk groups and pre-existing conditions over the age of 65. Do you have one pre-existing condition over the age of 6 months? Then you qualify for the vaccine, or a physician can qualify. He wants more research going forward. He wants more transparency. He doesn't want to rely only on drug company data. The one thing we have to wait and see, and the elephant in the room here, is what CDC is going to say, because as you know, they've been in a lot of upheaval this week.
They certainly have been, and there's more to come on that as well. Let me just give you 30 seconds to tell me your take on the whole nicotine situation. FDA, CDC says no nicotine is safe. RFK Jr. maybe saying the pouches are okay.
Well, his point is that cigarettes cause lung cancer. Cigarettes have tar and formaldehyde and arsenic in them, and the pouches just have nicotine. Now, nicotine can lead to heart disease and can promote tumor growth, but I agree with him. I use those pouches as a way off cigarettes. 2 million people taking them. I worry about teens taking them too much, but I think they're a lot safer than cigarettes, and I think that's what RFK Jr. was trying to say there.
All right, you can do that in 30 seconds. We appreciate it. Thank you so much, Dr. Siegel. Good to have you.
Hey, Sean Hannity here. Hey, click here to subscribe to Fox News YouTube page and catch our hottest interviews and most compelling analysis. You will not get it anywhere else.